Welcome audience to this webinar on COVID-19 India Fights Back, Strategy and Way Forward. This is, as you know friends, once in a century pandemic. We have so far 1.86 million positive cases across the world with about 1,15,000 people dead. Everybody is concerned, everybody is talking about it. To discuss this further, we have two very eminent guests with us on this webinar. I would encourage the audience to fire in their questions through chat box, and we would be happy to answer those questions. So let me first introduce my panelists. Dr. Vinod Paul is the member Health NITI Aayog. He is an eminent doctor who has worked for his whole life dealing with public health issues, especially maternal and child health issues. He's a researcher and academic, and he has been working with health systems of multiple states and also at the national level. He is also the chairman of the first Empowered Group number 1, which has been tasked to prepare the emergency medical action plan. Our second guest today is Mr. Amitabh Kant. He is a CEO NITI Aayog and has been a distinguished civil servant with over 40 years of public service, known to be very dynamic, go-getter and highly result-oriented, a branding guru, a prolific writer, a thinker. He is the chairman of Empowered Group number 6, which is looking at securing partnerships with the private sector, with the international organizations and the civil society organizations as we battle this epidemic. Welcome to both of you, sir. We will proceed on a question and answer session. I will ask some questions, and then later we will invite audience to fire in their own questions. So let me start with you, Dr. Paul. What is coronavirus? What has made it so deadly? Why is the whole world talking about this? I think it's a conversation which is going on in the political circles, in the government circles, and also in the households.
Well, a virus is an organism which essentially comprises of nuclear material, and in this case it is RNA. There are other viruses which are DNA viruses, and this is just a nuclear material. By itself, it is looks like salt, and it does nothing. You can put it in a jar and keep watching it. But once it gets into animal cells, then it fuses with the nuclear material of that cell and then modifies the behavior of the cell and acts as if it's an organism. It has life, it has effects, and brings about a very major change in the pathophysiology and the biosystem of that animal concerned by changing the cell dynamics where it infects. So that's a virus. Virus is not living being on its own. It needs to have a living cell. Once it fits in there, then it starts to show its colors, as we see. Well, the virus emanated apparently in Wuhan, in China. It is a combination of nuclear materials coming from animal sources, possibly a bat, and then it is combining with another form of virus, which was originally also already active in human beings, and a combination of this became a lethal combination. It could have been simpler, but in this case, the nature devised this virus to be very, very contagious. It is extremely contagious compared to other conditions. For example, the famous SARS virus is only 1/4 contagious than this. It is not as contagious as measles of the old, which is largely disappeared from our country. And measles, if it occurs in one household, all children in the neighborhood would also get affected. But it is among the very, very contagious viruses. It travels through respiratory droplets. It houses itself in the nasal passages, the bronchial passages, the throat, and of course the lung. That's where it loves to reside. And it by classification, it is one of the flu viruses. Flu viruses keep on mutating, keep on changing. There have been epidemics of pandemics of flu in the past, and this flu virus named coronavirus because of its peculiar structure on electron microscopy is an RNA virus, which is a deadly virus. It's spreading very fast all over the globe, and today it has taken the shape of a
fatality higher than other similar viruses?
Yes, indeed. Its fatality is among the higher compared to a common flu virus, which is currently the H1N1, which is mortality of 0.1%. And here you see a typical mortality of not less than 1% overall, 3 to 4% typically. And then in situations in many countries, developed countries as well, the rates of mortality are as high as 6 to 8%. This is among higher mortalities, but just to make a comparison, compared to SARS virus infection, it is less lethal. But this is no respite at all, because if it has its ability to spread hugely the way it has spread, as you know, each individual is typically giving infection to 2 to 3 to 4 people, and therefore its infectivity is much higher than some of the other viruses that you're talking about. So coupled with that, it is a very, very dangerous virus. It produces a severe disease in the lung, which is a form of pneumonia, which leads to filling up of the lung with inflammatory cells and debris, and respiratory function of the lung is lost in severe cases. One important point can be made right away, and that is its lethality is so much more in individuals who are old age and who have comorbidities such as diabetes, kidney disease, and hypertension. In the young, it can be, and often it is, mild disease with very little mortality. Fortunately, the virus does not infect as many young people below the age of 15 years as some of the other viruses.
So, some of the early projections based on epidemiological models on assumptions of basic reproduction number, which is 3 or 4 or what you are telling, they predicted huge numbers of infections and fatalities, not only for India, but also for all countries across the world. In India, for instance, one model projected almost 18 crore infections and 12 lakh deaths. Currently, we have 9,000 cases and 300 deaths. Do you think they were, highly alarmist models, or what? And this is true not only for India but even for other countries. For US, for instance, the famous Imperial College study said 2.2 million deaths. It doesn't look like anywhere near that number, nor it is likely to go to that number in the near future. So do you think we are unduly alarmed about this particular phenomenon?
Well, these mathematical models, first and foremost, don't take into account what the society would do even before the vaccine comes up, what it would do in terms of containment. So these are the models which you can say are predicting situations which have nothing to do with the actions that you would take in every which way. And we can come to those actions, and the most profound one is social distancing, which increases the space between two individuals, so the virus finds it difficult to transmit itself. But they use the epidemic behavior of respiratory viruses, the spread that normally happens. It's a sigmoid curve. It goes up and then it settles down till the herd immunity in the community is found. What we mean by herd immunity is that there are not enough people left who are uninfected, and therefore the virus has to traverse much further to find an individual who has not been exposed, and because he's not been exposed, there are no antibodies in that. Once you have antibodies, that person is protected, and therefore if a large number of individuals have antibodies in their system, the virus would then stop spreading. So this basic modeling happens using such an understanding of how respiratory virus-related epidemics perform, but they largely do not take into account several things that could come in the way in modifying this. For example, the actions that are taken. For example, the weather and humidity that can play a role, not necessarily in this one, but elsewhere it can play such a role, and so on. It also doesn't take into account the differentials of susceptible population in terms of, let's say, old age, which would vary from situation to situation, and so on. So these mathematical models tell you a potential behavior in the absence of major steps that the society could take in combating the epidemic. But they tell you what havoc can be unleashed by such viruses and such epidemics. We have already seen unprecedented situation. It's an event as important as World War II, as everybody says. It is a pandemic that the world has not seen for a very, very long time. It has spread faster than many other pandemics because we have one globe, one world, and we travel from one place to the other. It has gone to practically every nation over a very short period of time. Do not take it lightly at all. Things can go out of hand. Things happen. The virus is lurking, and it would pick up its victims as it likes. Therefore, it is important to be vigilant. And I would also say that we may not even as yet seen the interval of this long movie. We still do not know how it will pan out in other countries. Even in China, today there is a report that there is we are witnessing a resurgence of infection in certain pockets because a large part of China, just as India, is virgin. We are all susceptible. So the goal eventually becomes not only to see how much overall containment can we do, but to make sure that we lose minimum number of individuals. We reduce the mortality to the minimum. We reduce the human cost to the minimum.
But in the absence of, the response mechanism, as you said, has NITI Aayog done some amount of assessment of what are the likely numbers for the India? Because that would be the basis for which you would prepare for that emergency. So what are your own estimates regarding this?
True. We, as NITI Aayog, we have looked at all the estimates that have been done by academics in the world, academics in India, and then we instituted at least 3 of our own modeling exercises using different assumptions. For example, one of them used mortality tracking as a way of predicting progression and then back calculating how many infections must there have been. We used the SIR model in one, and we used the organism-based model in another one. So we as a NITI Aayog, being the think tank, approached this from all directions to understand how much potentially could be the size of the outbreak in India, what could be the various scenarios from the median to the high bind as well as the lower bind, and how much could be the potential human loss. So those estimates have been done. Ultimately, we came down to a very pragmatic way of looking at our response to this outbreak, and we said we need to ensure that by very extreme measures such as the lockdown, we will keep the curve so flat that it fits into the reasonable capacity of our health system. We will not let it go beyond that. So that drove the principle of preparation. Because once you create an extreme situation like lockdown, when the distances become too big through social distancing for the virus to traverse, then the viral spread would diminish for that period. And then we can do business in terms of looking after the health of people. And then hopefully things would change eventually, slowly but surely. So we took a pragmatic view and we said our preparedness should be such that we are able to handle a surge of new cases to the extent of 150,000 per day. So we'll prepare ourselves as if every day there are 150,000 new cases. Now, by the way, this is the number or a corresponding number which is the same as Italy experienced per day when they were experienced this peak in their own country. So we said that is something at least for which a situation for which we should be ready, and we will in the first instance go for that level of readiness. We will review as we move along. We can raise our preparedness to a next higher level if need be, and we can downgrade if need be. In any case, there is no harm to do a lot of front loading in preparation and to be little over prepared rather than be under prepared. So we are working with that number, and then we used the potential trends and potential numbers that would require hospitalization, that would require simple care, and that would require tests. So the health system requirements then were built around that.
So one of the things, one of the points or critics argue that India has low number of cases not because there is less infection. Actually, there are a lot of asymptomatic people floating around in the population spreading infection. But since we are testing too little, therefore we are getting too little positive cases. Is that a fair criticism?
Well, one thing is valid, that we have no accurate estimate of the asymptomatic proportion of this infection. That is one, and there are practical reasons for it. But what we are very certain is that it is not an outbreak which is causing severe morbidity in any significant way. We are not too far away from the real situation, and I'll give you a couple of data sets to support that. Firstly, we looked at the consumption of medicines that are used in fever and cough. This is the face of COVID infection. It looks like any other flu-like illness, or in severe form looks like pneumonia. Then you discover it is not because of H. influenzae or pneumococcus, but it is because of the SARS-CoV-2 virus. So what we systematically examine this, is there a higher consumption of those drugs that are used in situations such as influenza-like illness and such as pneumonia, and we find that there is no increase in consumption of such medicines from the market. Number two, when you look at testing, whatever testing we have done, and testing rates have been rising, we do not find that the rate of positivity in tests goes beyond 4 to 5%. It's almost static. We don't see that suddenly now, when you're doing more tests, the proportion is 20%. No, it doesn't happen. Number three, we looked at how through routine data collection, through our integrated disease surveillance program, year by year, how the behavior of acute respiratory infections and fevers on the ground has been in various states. And we find that compared to 19 and compared to 18, the incidence of respiratory infections as measured by this very stable system in the community in various states is not different at all in 2020. In fact, if at all, the respiratory infection rates are somewhat lower. We do not see a spike of respiratory infection. Ultimately, it is a respiratory infection in a syndromic way. Then we looked at how the Pradhan Mantri Jan Arogya Yojana, Ayushman Bharat packages are being consumed by the people. As you know, 500 million people are entitled to care as a right, free of cost for secondary and tertiary hospitalization under Ayushman Bharat PMJ. There are 5 packages which could be the face of COVID infections. And these are pneumonia, unknown fever, respiratory failure, and so on and so forth. We systematically track these packages and find that there is no sudden increase in any part of the country, no increase at all, in fact, overall. It is consistently the same proportion that is being utilized as packages. We also have not heard anecdotally that the hospitals are getting filled with serious patients who need to be admitted in intensive care units, and the ICUs are getting filled up. There are big queues in front of private or government hospitals. No, But in Europe, for example, this is what exactly is happening. There is no space left in large hospitals, whether it is Geneva or London. All critical care units are full. We definitely do not see that. We have no newspaper report, and we are watching this very systematically. We are in touch with people on the ground, both in the public and the private sector, and we can surely say that there is not an undercurrent of severe disease of that nature floating around. With reasonable evidence and with full authority and responsibility, I would say that our disease is very, very limited compared to the size of our nation and compared to the size of the pandemic in other countries. It is limited because India resorted to very important and early and effective steps, and we'll come back to that. And we are okay so far. It does not mean, of course, a word of caution, that the situation would continue to be so unless we remain vigilant, we remain sensible, and we take right decisions at the right time as we move on. As I said, we are still in the early phase of this problem in the country. We still have more than 300 districts where there has been no case, and these are all susceptible populations. And therefore, we have to be ready that things do not get out of hand. But as of now, the testing or no testing, our disease is around about the same that we report. There can be some misses here and there, but that problem is minuscule, if any.
So one question which is, last question. So one question which is uppermost in people's mind is that flattening the curve is right. So you only slow the spread of infection. Eventually, either everybody gets infected or a large proportion of people get infected when the virus stops propagating, or we find a vaccine or a drug to cure the disease, which is 12 months to 18 months down the line. Now, suppose from a medical perspective, if we are to end the lockdown tomorrow, what are the chances of a flare-up of that infection? And should, from a medical perspective, what should we guard against for preventing such a eventuality?
The lockdown is the biggest public health decision of this nation taken by the Prime Minister. This is a decision of a century. The purpose of lockdown has been achieved to a very, very large extent. It has flattened the curve, and the curve will remain flattened, and we have two things happen. One, we have changed the behavior of the people collectively. As a society, we have moved to a new normal in which we know the importance of social distancing. We have practiced this full time in the last 21 days in every household. We have adjusted to new reality, and when our Prime Minister will tell us that this kind of a behavior has to persist beyond the lockdown, people will follow because truly they all believe in this. All state of public believe in this, and they know that it is in the interest of their own interest as well as their family's interest, and also in the interest of the nation. So that is a very important achievement of the lockdown, apart from flattening the curve. When we move to a stage where the lockdown has to move toward more normal life by way of activities and so on, there are four considerations that we would like to keep in mind. A, we must ensure that our behavior is conducive to ensuring minimum spread of the virus, which will lurk, as you correctly said. We make it difficult for the virus to catch us. We make it difficult by wearing the mask. We make it difficult by keeping the distance. We make it difficult by washing the hands. So we cheat the virus. Virus shows you that mathematical modeling only when we are all huddled together in the worst case scenario. Those numbers are worst case scenario. But by changing our behavior, we will dodge the virus, hurting us. That's number one. So our post-lockdown, peri-lockdown, and for a significant period of time, our social behavior, our lifestyle has to conform to making difficult for the virus to traverse. Second, our health system preparedness has to now kick in fully. we have to make sure that we are prepared to tackle a disease which may be manifold compared to where we are. Those preparations are on foot, and the lockdown has provided us opportunity by way of very precious time to be ready for it, to be getting our supplies in order, to getting our COVID hospitals in order, to getting the the HR in place, and so on. Coupled with this would be the preparation in terms of surveillance. Our surveillance has to be even more intense. This is an epidemic this is an outbreak which could happen somewhere tomorrow in a totally unpredictable way. And we should be able to, we are already stretched with the amount of problem that we have. And yet we have to be prepared that if it breaks out in any part of our country, our surveillance system will respond, it will be resilient, and it will guide us toward the right action. So that is the second part of our preparation, apart from health system being together. And here, I want to compliment the private sector, without which our health system is incomplete. India has one health system, public and private. We are together in this battle, and the private sector has risen to the occasion. We will put together all our energies, both for infrastructure and HR and skills and so on and so forth, and respond in one integrated system. So that is the second part. The third is that we, in a calibrated way, have to open up economic activities and livelihoods. And that has to be calibrated, planned, phased affair, where a balance is created between losing minimum number of lives and losing minimum amount of our productivity. But the fourth one is very important, and it is special to our nation. We are a science and R&D power in our own right. In the sphere of biotechnology, health sciences, and biopharma, pharmaceutical industry, we are a giant. We have been the pharmacy to the world. We have our national laboratories are second to none. We have the capability to create science solutions for our country and for the world to combat this pandemic. And specifically, it means that we will create diagnostic tests that work, and already 3 to 4 to 5 innovative products are there in the market. In the last few weeks, they have been put together and they're floating. And I'm happy to say that at least 4 vaccine candidates, products are available in 4 of our national laboratories. There are 4 industries collaborating with counterparts overseas to work on potential vaccine candidates. We know that whoever discovers a vaccine, even if it is outside India, we will be the manufacturing hub. But we will be so much more proud if the vaccine that comes first on the market, on the global scene, is an Indian vaccine. Also, we have strength in drug discovery, drug-related research. Several molecules are being pursued relentlessly. And this ultimate war against COVID will be won by science and research and development. And here, India has a very strong presence, has an edge, and we will make all efforts to make sure that our research and development industry is fully charged, and no stone will be left unturned to ensure that they achieve the goals of having such products that will finish the war against COVID-19.
Thank you so much. From the economic front, Mr. Kant, this pandemic is surely a health crisis, but it's also an economic crisis. It's a battle between lives and livelihoods. Has the government made any assessment of the economic distress that this pandemic is causing, and do we have some plans to address that distress?
So, look, I think the critical thing was that this is a disease which has an exponential growth, and it was very necessary from a government perspective to have used what one Stanford data scientist Thomas Pio said was the hammer approach, so that you could flatten the curve and you could then allow time for our health system to be able to build the response. And in any for any responsible government, the first and foremost task is to protect the lives of its citizens. And that is what the government has done. Now, when you do a lockdown for a long period of time, it has implications in terms of economy. We've done several analyses on this, but I think the important thing in the first phase was to protect lives. And in the second phase, as the Prime Minister has said, is also to protect livelihood of citizens. And therefore, while the essential services were kept open in the first half to ensure that people get food, people get medicine, that supply chain was kept intact. I think in the next phase, probably we'll see much more opening up. But it's a very, very tough policy choice for any decision maker, that to ensure that there is also very few fatalities, which fortunately India has been able to do, have low levels of fatalities as compared to what the Western world has seen, close to about 10% plus, whereas in India, we've restricted it to about 3.42. Our fatalities have been about 0.05 per million, as compared to about 242 for USA, about close to 230 for Spain, and so on. So therefore, it's very, very important that we ensure that people are able to protect their lives and we are able to protect their jobs and ensure that people do not fall below the poverty line. And therefore, the next phase of the strategy will also to do the right marriage and to do the right blend between the two. But I wanted to add to that, Alok, that in the forefront of this war, actually, this is a very big war where the enemy is really unknown. And in this war, actually, the war is being fought by our doctors, our nurses, our paramedics. They are our real heroes. And it's very important for all the citizens of the country really to take care of them and give them all the tools to protect themselves. And without that, if we are not able to look after our doctors, it will be very difficult to fight this war. Secondly, it's very important that we take care of our elderly citizens, our parents, our elders, because this tragedy is going to hit people above 65 and those who have comorbidity. And therefore, if you have diabetes, if you have lung problem, the chances of your suffering is very high. And therefore, it's very important that we keep our elders, our parents at home. And this is a must, absolutely. And thirdly, I think it's important to realize that this battle will be very difficult to fight by just physical means. It has to be fought very intelligently. It has to be fought with a lot of use of technology. And therefore, the government in a whole of India approach, where public and private partnership has worked, we have demonstrated this great use of Arogya Setu, a new app, which has been widely downloaded. Over about 4 crore people have already downloaded it, 40 million people in just a few days. And this is a very, very powerful tool because you can do contact tracing. Imagine, if you're not to chase people physically, but do it on just one click, you'll be able to find out as to who are the people with whom somebody who's got impacted has got in touch with. So it's a very, very powerful tool, and it's very important that everybody downloads this tool and enables us to really fight this war very intelligently and with technology. And the fourth point I want to make is that actually a lot of people may be suffering because we are really fighting this war against COVID-19, and many people may be suffering because they are not able to consult their doctors. And what the government has done is that we've come out with this telemedicine policy. And this telemedicine policy must really drive, we must move away from just face-to-face consultation with doctors, but use technology to consult doctors. We are all used to taking photographs with our mobile phone. Shoot your photograph, send it to your doctor, consult him on mobile, and that's the way the future will be. And the last point I want to make is, which to my mind is very critical, that our health sector has really suffered from lack of investment over the years. We've given about 1 to 1.5% of our GDP, but this sector, in a vast country with about 1.4 billion population, you need a lot of major investments in healthcare. We need many more doctors, we need many more specialists, we need many more nurses, but we need a good quality primary healthcare. And that is where a lot of investment has to go in. And therefore, this corona crisis should really open up the eyes of all the state governments as well as to put all their resources, good resources, into investment for primary health care in India.
Another question, sir. So I fully agree with that this, a lot of work is being done. But the way the lockdown was implemented, we have supply chains being disrupted, even for essential services. Our ports are getting clogged. We hear reports of shortages of personal protective equipment for protecting our frontline doctors, nurses, and paramedics. Ventilators are in short supply. We are unable to, even for some certain category of pharmaceutical products, we were the factory of the world. Export orders are getting held up. Do you think the migrant labor, because of this sudden lockdown, there was a huge problem with the migrant labor, which do you think that as we go for the next phase of probably relaxing a little bit more of this lockdown, is the government prepared to deal with this in a more planned manner? And do we have partnerships with industry, with international organizations, because you are heading the Empowered Group to forge these kind of partnership with civil society organizations, that we can handle this lockdown better in the next phase?
Yeah. So we've had very detailed deliberations with the private sector across the board, with all associations, with all their members. We've had discussions with international organizations. We've unleashed the power of 92,000 NGOs who are registered on NGO Darpan. And we've said that many of them have done some phenomenal work in the field, working in partnership with the districts and the state government. Now, we must realize that when the first lockdown was implemented, we did not have much time to prepare, and therefore there was some issues of supply chains. There were issues of migrant laborers, but they were immediately, the important thing was to ensure that the infection does not spread to the rural hinterland of India. And therefore, we had to contain that, and we did that very effectively within the next 24 hours. And similarly, the first day we had problem on essential supplies, but since then, we have ensured a very good supply of essential goods and commodities and medicine supply as well. But as we go on, what we need to ensure is that the entire supply chain from the consumer to the point of production across sectors will have to be taken care of. And that is the work which is presently going on. Whatever the decision at the highest level, we will ensure that it is implemented to the best of our ability. And this will be critical. But I think the important thing in this is that the migrant worker would be very, very restless. I mean, the migrant worker is kept in camps in several places. Some have gone back. Many of them are still in the factories. We need to revive the factories. The private sector has been told to pay them 100% wages. And therefore, it's very important that as and when industrial activity begins, we are able to see that these workers start working again, and they are able to get the industry back in action. And those who are stranded, we should be able to do this with full care. A lot of NGOs have done some great work in feeding them to ensure that they keep getting good food, and to ensure that they either are taken back after adequate amount of testing back to their home, or they are taken back into the industry. But the important thing, Alok, is that life has changed. We are not going to live the same lives anymore. There's going to be a tremendous amount of transformation. We'll not be that same extent of social human beings. And therefore, maintaining physical and social distance, wearing masks, maintaining a high level of hygiene, ensuring that even when factories start, there are adequate number of shifts, and that there is gaps, there is adequate amount of break given. All these are absolutely necessary, and we must take care of. And it's not possible to do this by government. Every single industry, every single individual has to do this. This has to be a conscious awareness. Because if we open up and there's again resurgence, we'll have to again go in for a long lockout. And therefore, it's very important that individual discipline is the key to our success. As Dr. Saab said, each one of us have to be very, very disciplined to fight this virus.
So an economy is compared to a plane flying on the petrol of revenue. Now, because of the lockdown, the petrol has stopped coming in. How long do you think this economy can survive on a glide mode?
So these are
number two, sir. The PM Garib Kalyan Yojana has been announced, which takes care of some part of the problem, particularly with the poorer sections of the society. Industries have stopped completely; their revenue systems, revenue models have gone. They are bearing up for the salary. So for this, without zero revenue coming in, they are still liable to pay the salary. Do you think there are more steps on the offing? Should there be more steps? And what is the government looking at doing this? Because we are in it for a slightly longer haul. People tell us that till the vaccine is discovered or a drug is discovered, which is about 12 to 18 months. So we need a much longer duration plan.
Yeah. So three things. One is that when this happened, the government immediately came out with a welfare package of 1.7 lakh crores, and that covers a lot of our, farmers, our unorganized workers, whom we are tackling through direct benefit transfer, our self-help groups, our women, all of them were taken care of. The second aspect was a series of measures which the RBI took on the economic front. I think it slashed the CRR, it slashed the repo, it slashed the reverse repo, and did a lot of things and deferred the payment of interest for a period of 3 months. But irrespective of that, the crisis is severe, and therefore the government will be taking, I'm quite sure the finance ministry is taking several measures, and you will have several other packages as we go along in this crisis, because you have to meet the requirements of our small and medium enterprises, and you have to ensure that we take care of our large enterprises, which actually provide businesses to the medium and small enterprises, because this is a very, very unusual crisis. I don't think we even had a crisis like this during the 1928 Great Depression, and therefore India financially needs a new deal, and this will be a new deal, not looking at the fiscal impact of it. We need to look afresh. This is also an opportunity to think big and think large.
So to bring the opportunity, every crisis is also an opportunity. Yeah. What do you think are the lessons to be learned by businesses, by government, and how can we? So there is a goodwill that India has earned in terms of supplying medicines to even the most powerful countries in the world. Is there an opportunity? Do you see an opportunity at this point in time? And what do businesses and government need to do to cash in on the opportunity? Because I don't think we will get this opportunity again.
No, the one lesson which clearly comes out is that you have to be as far as essential supply of ventilators, PPE, testing kits, there's no rationale why they should not be manufactured in India. And these are essentials which must be manufactured in India. We must build up the entire supply chain here. That's number one. Number two, the clear message is that the world will change. You will get into new areas of growth. And there will be a huge range of new areas of growth. So supply chains will get disrupted. And because supply chains will get disrupted, most of the manufacturing used to take place in China. And that will get disrupted in a very big way. And this opens up the opportunity for many countries. And I think it opens up the opportunity for India. And we've announced a major scheme on mobile manufacturing. We've announced a major scheme for active pharmaceutical ingredients. And similarly, we need to look at 5 or 6 key sectors where we need a key focus on manufacturing in India. And that, I think, is the real opportunity for India.
And what about for businesses? Do you think the way these delivery mechanisms is happening in the current system, let's say auto sector or IT sector or even education sector, technology seems to be, now because of this forced lockdown, we are being forced to innovate. Do you see a lot of innovations and a scope around innovations where the ways of businesses doing business will alter completely?
So you will see a lot of use of more technology. You will see a use of a lot of more artificial intelligence. You will see a lot of more use of robots. But in India's case, it's also important because we have to look at employment creating sectors. We need to look at textiles, for instance. We need to look at gems and jewelry, for instance. And these are sectors which create vast employment. So these are areas we need a twin approach of going massively for new technology in cutting edge areas, whereas also looking at job creating sectors like food processing, textiles, etc.
I have a question. This is also a season for harvesting. How do we make sure that harvesting activities are not harmed, they are protected, even when we are fighting this big war?
So this is a key
agriculture sector.
So, Dr. This is a very, very key question that you asked, is about really agriculture sector holds the key to our livelihoods, and therefore the government made it provided an exemptions for all areas in the agriculture sector, so that both the Rabi and the Kharif crop remains unaffected, and we are able to carry out full cultivation and ensure that the crops reach the market and ultimately the ultimate consumer. So all exceptions have been made, and in every state of India, I cross-checked with the Agriculture Department, on every state of India, I think we've seen the threshers moving, we've seen the workers being available, and we've seen the agriculture cultivation taking place.
There are a few questions. There are many questions which this discussion has spawned, but a couple of questions I will take. One question comes from Shyam Dhanuka, and this is addressed to Dr. Paul. And this is about the pool testing which Andaman and Nicobar Island has started recently. When will it be rolled out in the entire country? And may I add that the RT-PCR, the way you take throat swabs or nasal swabs and identify the virus through the RNA, that takes a long time and it's very expensive. When will we be rolling out the antibody or the serological test, as we call it?
So two parts to your question. One is pool testing, which means you take the material from, let's say, 20 individuals, run the assay as if it is 1, and if it is negative, you declare everybody to be negative. If it is positive, then you pick up each one of them and do it one by one. So in a situation where the positivity rate is expected to be low, this is very economical and faster. And I do believe that we have now enough data for this approach to be taken. When we are scaling up our testing in a very big way, this will be one of the approaches that should be systematically applied. I endorse this. I think we have enough evidence and enough practical experience for us to take that forward. The antibody test is a different genre of test compared to the RT-PCR. RT-PCR picks up the virus that you pick up from the throat, and then you process and you pick up and you look at the virus genome, let's say. So that is a gold standard in diagnosing the cases, and that's how the cases are being done, diagnosed and being confirmed and reported. The antibody test is a much simpler test compared to RT-PCR, which needs a machine, it takes time and so on. But the antibody tests are taken even from a finger prick. They show you whether your body has generated IgM class or IgG class antibodies in response to the virus's invasion into your system. Firstly, it takes about 5 to 7 to 8 to 10 days for the antibodies to come up. So I can have infection, but if you do the test on, say, second day or fourth day, it is going to be negative. But yes, by 8th, 10th day, it will be positive in most tests that are available. So it has a place, but it has a place only in two ways. One, it could serve as a precursor to an RT-PCR, because if it is negative, it still does not rule out that one person has infection. If it is positive, it helps.
It's a screening.
So it can be a screening and therefore tied up to a systematic RT-PCR that follows in certain instances. But its real use is helping with the surveillance. That if you go out into the community today, let's say we go to Dharavi and we run this test on, say, 500 people. If the test is positive, it will say that this person has been exposed to infection at least at some point, and therefore tells you what the burden of the disease in that area is, how much of the virus has been lurking there for a period of time. It therefore helps you in doing so, and also it allows you to understand the disease, because once you are positive, you may ask the question, did you have fever at all or not? And you'll find the asymptomatic ones were leading their life in a normal way. They had no problem at all. And then there'll be some who will say, but I only had mild cough. So you know the proportion of mild disease. And then some would have been those that were actually went to the hospital and were supported. So it has a huge role in surveillance.
When do we start it, sir?
It will be useful. We have imported, the ICMR has imported 500,000 of these tests, and there's of course difficulty because a lot of competition among the suppliers, a lot of competition coming in now with cartelization. The suppliers are few and people are competing. Nonetheless, we are also building this test in the country, and we will very soon also have these opportunities of domestic consumption,
so
domestic production. So it is an add-on, and once we have enough kits, it can be combined with a rational approach where RT-PCR and antibody tests work in a certain systematic way.
There's a question from college student, very interesting, Harshit Tisodia, and he says, what can students expect as the lockdown has disrupted classes and academics? Many students are unable to join online classes.
So the challenge really is that it'll be very difficult to open schools and colleges, to my mind, till 31st May, because group functioning is very, very tough right now, and therefore the only way to move forward is with online classes. Many schools, many colleges have moved over to online learning, and that is the way to go forward. And this is the area of the future. All education will get online, and therefore the earlier you do it, the better it is.
Another question to you, Dr. Paul, and to your field. How can the virus affect pregnant women? What special care must be taken? This is a question from Dhruvi.
Yeah, this is a very valid question, because pregnancy by itself is a huge change in the physiology of the woman. There are so many perturbations to protect the interest of the woman and more so of the fetus, and therefore it is a different kind of physiology, and onto which if you impose a stress, and that also stress in the form of a live, lethal, dangerous virus, it adds extra stress to the life of both the woman and the baby. We are also learning that it is possible that the transmission of the virus can occur vertically from the mother to the baby. Still, the jury is out. We have to wait for more studies to be done. But the fact remains that pregnancy and COVID combination means we have to be very careful in terms of supporting both the baby at birth as well as the mother throughout the pregnancy. We have to be equally mindful of the fact that the process of delivery is associated with exposure of body fluids to the health personnel, body fluid to the baby, and baby itself is also vulnerable because of the poor immunity or the immunity being low. And therefore, it is a special situation. The protocols for looking after the mother and the baby, the perinate, have been now devised, and we should stick to them. We are also maintaining a registry of pregnancies associated with COVID-19.
Is this available somewhere on the web?
Yes, it's available on the web. If you go to AIMS Newborn website, it's available. And also on the FOXI website, it's available, because it's been done with FOXI, Indian Academy of Pediatrics, the National Neonatology Forum, and the All India Institute of Medical Sciences.
So another question to you, sir. This is by Shitanshu Shinha. The question is, how do we build confidence in the public, especially with the use of Arogya Setu app? I presume he is referring to privacy concerns.
So it's a privacy first app. Actually, all the data is on the phone itself. It gets deleted within 30 days. It has the highest levels of privacy standards. In fact, your mobile number is never used. You're given a separate DID. That's a separate ID is given, and that is used only to identify hotspots. So it has some of the highest levels of privacy standards. You can rest assured on that for us, it's privacy first.
So another question addressed to you, this is from Sunois Capital. And the question is interesting. Is it advisable to use our local kirana stores instead of e-commerce chains for our needs?
It's an important question because I think, to my mind, kirana stores should function and they should function 24/7. In fact, my view is that we should devise, whenever we open, we should devise a policy of working 24/7 so that we space out. We are spread out over a period of time rather than crowding around during peak hours. And many of us can go and do our shopping in the night as well. So yes, kirana stores, because most of you go and buy, individual shops should be kept open.
So last question, this is addressed to Dr. Paul, and this is a question from Dr. Vishal Saube. He asks, this is also in your capacity as Chairman, Board of Governors of MCI. We are foreign medical graduates and are waiting to serve the country. Is there any policy in this regard?
Well, if you're a foreign medical graduate, there are two categories of you. One, who have already appeared in the exam and are finishing your respective internships within the country or outside. For you, we will be instructing the state medical councils, even during lockdown if need be, maybe toward the end of the month, that they will register you and a process of that nature should be initiated. This is the premise on which I am engaging the BOG, essentially to say that there will be no delay in registration by the state councils despite the lockdown type of situation. And therefore you could then be incorporated into the workforce and you pick up your tasks and start working in appropriate places in the country. If you are waiting to appear in the exam, I would suggest to you that exam is due very soon. Please go through the exam, do well, because the moment you pass the exam, we will employ you as interns immediately. You then become part of the medical workforce at the level of intern, compared to the other person who is at the level of a MBBS qualified equivalent UG qualified doctor. But we need interns, and we will approach all of you to join the health system. As I said, it's an integrated health system. We'll place you in a government facility or in the private facility in this endeavor to handle COVID-19. I urge you that use this time to prepare well, and we look forward to your joining us very soon as interns.
Thank you so much for such an illuminating discussion. There was lots of ground which was covered. I wish we could have taken more questions, but please do keep on firing your questions. We'll try and answer some of those on an online electronic mode. Thank you so much, both of you, for sparing your valuable time and hosting this webinar.
Thank you.